Good evening, everyone. It's so good to be part of this great initiative by Dr. Mohammed, because me, for a person, I believe that preventive medicine is not only cheaper, not only better, but cheaper than curative medicine, and is just one part of medicine that is not really focused on. So I always like it when I'm part of things like this. So today we'll be talking about one word many of us dread hearing, even if we don't know or do much about it, but we dread hearing the name cancer. Cancer, whenever we hear the name, we're always very afraid. And I like to get on straight to it. What does cancer mean? If you are going to be explaining cancer in layman terms, one way just have to let you know that cancer is directly related to cells. And talking about cell, I know in our secondary school biology, they taught us that cells are the simplest units of life, meaning that every living thing is made up of cells, including the human body. Now, what happens in cancer is that these cells, which are supposed to grow and then at a point stop growing and die. But cancer happens when these cells just decide to behave abnormal. They grow, and they grow faster than normal. They never stop growing, and they refuse to die when they're supposed to die. So when this happens, the growth doesn't stop, and this growth makes these abnormal cells to begin to accumulate. They accumulate and accumulate over time because they are not dying. They're supposed to be dying and be replaced by another cell. But since they are not dying, they begin to accumulate, and form a tumor. This tumor also further accumulates because it keeps growing and never die. It keeps accumulating till it forms a lump. Now, the problem is that these accumulated cells that have accumulated to being a tumor and or a lump begin to attack all the normal cells around them and the surrounding tissues and begin to destroy them. It's like having an enemy army within your own camp. Like it's like forming a coup. You know, when in the military they call it coup d'etat. If particular group of army just decide to form a coup and begin to attack people that are in the same army with them, that's just the way cancer cells operate. So because of this clump up of large number of cells that have grown so much and they don't die, they become clumped together, don't forget, to become a tumor, and they might later become a lump, very big lump, and they just begin to attack other cells in the surrounding. And they don't end there most times. They don't end their war there. The most crazy thing about cancer cells is that this tumor might later break and spread to another part of the body and continue the same thing it's doing in the parts of the body that is coming from. For example, if somebody has breast cancer, the breast cancer the tumor in the breast might break and push these cancer cells to another part of the body, like maybe the lung or the liver. That's why some people end up having multiple cancers when their cancers are not managed in the early stage. Now, there are over 200 known types of cancer. There are over 200 known types of cancers, but today we'll be focusing on breast and prostate cancer. Focusing on breast and prostate cancer, let me quickly talk about prostate first before breast. Prostate cancer, okay, basically affects men, and it is cancer that happens in the prostate. Where is the prostate located? The prostate of a man is located between the man's bladder and his penis. That's where the prostate is. It's like a small-sized walnut-shaped gland. And the work of that prostate gland is to produce seminal fluid. Now, to understand what I mean by seminal fluid, you can also call it semen, but many people call it sperm. They say a man releases sperm. A man releases semen, not sperm, because the semen is the fluid where the cells, which is the sperm, is located. So it's possible for a man to release semen and not have sperm. That's why when some men, you send them to the lab for SFA, seminal fluid analysis, they come back with the results. And when you analyze it and you see a case like azoospermia, which means the man does not have any sperm, and you tell them that, sir, you don't have sperm. The man says, but when I have sex, I release. So it's always difficult explaining to them that what you are releasing is the seminal fluid. It is the cells that are inside that is called sperm. So I just wanted to clear that. So the work of the prostate gland is to produce this seminal fluid that I mentioned. And what happens in prostate cancer is that, like I explained before when I was talking generally about cancer, is that the cells in the prostate some cells in the prostate begins to behave abnormal. They begin to grow faster than the normal rate in which the other cells grow. And then the growth does not stop when it's supposed to stop. And when they're supposed to die, they don't die. The cells begin to accumulate because of the ones that are not dying. Please put off your microphone, please, so it wouldn't cause distraction to others, please. As I was saying, the accumulated cells that didn't die then form a tumor, and this tumor grows into a lump. Now, in most prostate cancer cases, the cancer is limited to the prostate. It does not cause much harm or pain. The person might not even know, and it does not spread to other parts of the body. But in particular cases, it is always very painful. The symptoms are always very obvious, and the spread is very rapid. It spreads to other parts of the body very fast. Now, this is why it is important to discover prostate cancer early. A man should pay much attention to prostate because prostate cancer is the second most common cause of cancer deaths in men. It is one of the most common types of cancer, and it is crazy to manage. Not to scare you, but it is crazy to manage. So, what are the symptoms? As I said before, prostate cancer might be asymptomatic in the sense that a man can have it and not know. Most times, before the man discovers, the cancer is in stage 2 or 3. So, but when you begin to see these symptoms that I'm about to mention, you should, as a must, see your doctor, and so that you can undergo checkup and we can be able to know if you have prostate cancer or not. Number 1 is if you have trouble urinating. This is urinary incontinence. If you discover that suddenly you don't feel the urge to urinate and you just discover that you have weed and or you have you have peed on yourself without notice, this is called urinary incontinence. If you just suddenly begin to notice that, especially if the man is above the age of 45, 50 upward, you should see your doctor. Number 2 is that if there is a decreased level of force in the stream of one's urine, meaning that if the urine is like breaking, I don't know how much, how well I can explain that. Like a man brings out his penis to pee, and then there is like a break in the urine. The urine does not come out completely at once. Like the flow is not there. Like the urine is coming out, and then there is a break, and then it comes out a little again, and then there's a break. Now, if that is happening, pay attention. Number 3, if there is blood in the urine. Number 4 is if there is blood in the semen. If you ejaculate and you discover that there are blood stains in your semen, then you should pay attention. Number 3 is if you have severe bone pain, especially in the bones that are around your penile area or your waist, you should pay much more attention. Then number 5 symptom is if you have uncontrollable weight loss. Just discover that you are losing weight uncontrollably, not that you are using a weight loss product or anything, or doing excessive exercise to lose weight, and discover that you are losing weight as a man, you should pay attention. Then number 7 symptom is having erectile dysfunction. Your penis is not erecting as it should, even after stimulation or not, then you should pay attention. Now, going away from the symptoms, let's look at the causes. What causes prostate cancer? Now, there is no clear explanation to what causes prostate cancer. But we know that prostate cancer occurs, like I explained before, well, when cells in the prostate develop some changes in their DNA. I hope I wouldn't cause a confusion with the DNA that I mentioned. DNA is like the program. It's like the program instruction in your cell about what that cell should do. So if there is change in the program in that DNA, it can cause those cells to be able to behave abnormal. They grow faster than they're supposed to, and they don't die when they're supposed to die. So that is what causes prostate cancer. Now, we have said that it does not have a definite cause, but there are risk factors. Risk factors mean factors that can increase one's chances of developing prostate cancer. Now, what are these risk factors? Number one is old age. Prostate cancer is common in men that are over age of 50. 2, race. Black men have greater risk of having prostate cancer than men of other races, whether Asia or any other race. Number 5 is family history. In fact, this is the biggest risk factor. If you have any of your relatives, either a father, a brother, a grandparent that has history of prostate cancer, then you should pay much more attention than any other person, because it is highly hereditary. The tendency that you will inherit that DNA is very high. Then lastly is obesity. Obesity, if you are obese, depending on the body mass index, your BMI, if you are obese, after knowing your body mass index, then you should be aware of prostate cancer. Now, that's that on prostate cancer. My partner is going to discuss more on the prevention, but I must say this, that there is a particular test that they call specific PSA, prostate specific antigen. Is a test, is a blood test that can help men to detect if they have a tendency to have prostate cancer or not. So I advise every man listening to me, or every woman that loves a man dearly, should advise the men to do PSA at least once in a year. The level of the PSA can guide your doctors in knowing whether to send you for a biopsy to discover whether you have prostate cancer or not. So any man that is between the age of 40 and above should do PSA at least once a year, or once in 2 years at the worst. That's that. Now, let me quickly talk about breast cancer, which is the most common. We're in the month of October, which is breast cancer month, a breast cancer awareness month. Now, I'm very passionate about this because maybe it's because I have lost 1 or 2 people that are dear to me, patients that I found that I form a kind of empathic bond with to this particular disease, breast cancer. That's why I kind of have a passion discussing it. Now, breast cancer, just like any other cancer, occurs when cells in the breast, like I explained before, begin to behave abnormal. They grow, they don't die, they accumulate, they form the tumor, and they spread faster than they should, than any other kind of cancer. Breast cancer spreads fast because before you know it, has spread to the nearby organs and it can be very bad. Now, what are the symptoms? The most common symptom is having lump in the breast. This lump I'm talking about, although you can have a lump in your breast and it's not cancerous, but if you notice an irregular lump in your breast, you should see the doctor for a breast examination. If you have an older age, the doctor might send you for a mammogram. And if the doctor strongly feels that it is breast cancer, he might send you for a biopsy to test whether the breast is cancerous or not. So if you have a painless hard mass that has irregular edges, that is, the edges are not smooth, they are a little bit rough, when you press, when you check, then you should pay much attention to your breast. Secondly, if there is a irregular swelling in the breasts, you should pay much more attention. If there is a sudden onset of nipple or breast pain that is not related to your menstrual cycle, because normally some women pain in their breast when they are ovulating or during or before their menses. So if you have this breast or nipple pain, or you have an inverted nipple, that is, the nipple is turning inward, which is supposed to be outward, the nipple is turning inward, you should pay much more attention. Then if you have a swollen lymph node in your armpit, most times the first place the breast cancer spreads to is the armpit. So if you notice a swelling in your armpit area, you should pay much attention to the breast. You should see a doctor for checkup. Then lastly, if there is redness around the breast area, if there is redness around the breast area, you should pay much attention. What are the causes? Like prostate cancer, there are no known causes, but there are risk factors. What are these risk factors? We mentioned age. If you are age of 55 above, pay much more attention. If you smoke, smoking is a major risk factor, whether it is cigarette or it is weed or anything smoke, predisposes women or men to breast cancer. Men also have breast cancer, but it is more common in women than men. Now, if there is a constant radiation exposure, that is, if the person is exposed to radiations, maybe from X-ray or other types of radiation, then the person is likely have higher chances of having breast cancer than people that are not exposed. Now, genetics is also a factor. If someone in your immediate family, maybe your mom, sister, aunt, is battling breast cancer or has had breast cancer, then you are at much risk of having it than anyone else. Now, breast cancer can be in stages from stage 0 to stage 1 to stage 2 to stage 4. Time will not permit me to go into the changes one might experience in these stages. I will have to drop my mic here so that my partner can discuss about the prevention of both prostate and breast cancer.